for today. Diana Nice is very busy with the Culinary Workers Union and, you know, all of what they've been doing to for the livelihoods and lives of immigrants. She will not be able to be with us, I understand. But you will hear from the national head of the labor campaign for single-payer health care. You will hear from the national president of a union of over 200,000 members who has included challenging militarism in his work. You will hear from the vice president of a teachers union, which through alliance building has changed the political landscape of our third largest city. You will hear from a retired VA nurse who has spent decades building intersectionality and solidarity, including around labor, healthcare, and anti-militarism. And you will hear from one of our members who has a half-century of leadership in both labor and peace, who is bringing anti-militarism to unions. Labor Working Group is currently has 8 active members who meet regularly. If you are currently working or retired union member, or if labor issues are important to you, we welcome you to join us. If you don't, we're going to be signing, or we're circulating clipboards for you to sign up. We would really appreciate your help working with us, and so you watch the clipboard and sign up, please. So, our first speaker is Roach, the National Coordinator for the Labor Campaign for Single Payer and Chair of Healthcare for All Minnesota. Roach is the National Coordinator for the Labor Campaign for Single Payer and Chair of Healthcare for All Minnesota. Ms. Roach retired in 2023 as the Executive Director of the Minnesota Nurses Association after working in the labor movement for 34 years. For more than 2 decades, Ms. Roach has been involved in the healthcare justice movement, both as a national speaker and trainer. So, is Rose here?
I'm sorry, we're just having a little tech trouble. Give us a sec. Yeah,
Once, in health there is freedom, health is the first of all liberties. Since no one understands freedom and liberty better than our country's veterans, connecting health to both seems an appropriate way to begin my remarks. Good afternoon. Greetings of health and solidarity from the Labor Campaign for Single Payer. The Labor Campaign for Single Payer is a single-issue organization within the organized labor movement. Our affiliates include a number of influential national unions as well as international unions, many of their local state federations and central labor councils. Our primary mission is to increase and coordinate grassroots labor support for a single-payer, improved Medicare for all healthcare system in America, because we believe that healthcare is a fundamental human right and that the labor movement must help lead in the fight for true healthcare justice. From a labor perspective, we know that our employer-based healthcare system is a convoluted mess. Why do we allow our employers to control our access to healthcare? Doing so has resulted in the greatest transfer of our wealth as workers to corporations, allowing the bosses to use our access to healthcare as an economic weapon against us in the class warfare that we are all engaged in. It's an absurd way to set up a healthcare system, disincentivizing entrepreneurship and career movement based on fear of losing access to healthcare. That's why we need an improved and an expanded Medicare for all system. Health, I think, is the issue of intersectionality across the justice movement, and protecting public health is something we all have in common. I'm here today because the Labor Campaign believes the correlation between the privatization of the VA is intricately tied to the privatization and corporatization of our non-VA healthcare system, particularly our public health programs like Medicare and Medicaid. Speaking of Medicaid, the drastic cuts to Medicaid funding, as recently passed in the GOP budget reconciliation bill, put at risk the health and financial well-being of families across all backgrounds, veterans included, with especially harmful impacts on communities of color. These proposals threaten to take away or sharply reduce coverage at a time when too many people still face barriers to health and opportunity due to long-standing inequities and discrimination in education, housing, employment, and other areas. People are going to die unnecessarily. It might be a newborn baby born prematurely, because almost 40% of all births in this country are covered by Medicaid. It might be someone with a severe disability, because Medicaid is the healthcare program that covers the majority of Americans with disabilities. Or it might be an elder family member, because Medicaid pays for 60% of all senior citizens accessing assisted living or skilled nursing care. It is a level of insufferable privilege that equates to pure evil. Our current system also perpetuates systemic and institutional racism upon which the system itself was built. Racial and ethnic disparities resulting from institutional racism, including historic underfunding of care for communities of color, using Black and brown people as subjects of medical research without their knowledge or consent, ongoing wealth and income caps, and suppression of voting and political power to address these inequalities have all led to higher rates of morbidity and mortality for Black and brown Americans. Racism is a public health crisis, and it needs to be addressed. But how do we address it in a system that prioritizes profits over patients? A system that says there are human beings who deserve health care and human beings that don't. We address it, I think, by creating a coordinated, interconnected system wherein everybody is in and nobody is out, no exceptions. The direct attack on veterans' health care is another case in point. Originally organized on the National Health Services model, facilities are publicly owned, providers are public employees, resources are allocated through comprehensive planning, and services are free at the point of service to all eligible participants. The Veterans Health Administration is the largest integrated health system in the United States. Many of its vast workforce are veterans themselves, and many of those veterans are union members, making it one of the largest unionized workplaces as well. It was designed to cater to the unique needs of veterans and has been a pioneer in diagnosing and treating veteran-specific diseases. It has also been a leader in developing systems of comprehensive and preventative care, focusing on treatment over a patient's entire life cycle. Numerous studies have demonstrated how VA care consistently produces better health outcomes than privatized health care at a lower cost. Through price negotiation and other administrative procedures, the VA pays about half as much as Medicare for drugs and other pharmaceutical products. The VA isn't perfect, but when compared to the privatized, profit-driven healthcare system, the VA stands out as a superior system. So what do we do about these assaults on our democracy, our public health, on our lives? We do what unions have always done. We educate, agitate, and organize, but we do so in coalition that stretches across the social and racial justice spectrum. The unique and special needs of America's veterans, coupled with the realization that bargaining for health care as if it's a negotiable benefit, it is not, it's a failed strategy, perfectly aligns our interests with each other to protect and expand public goods and services while striving to build secure lives for working class Americans. The Labor Campaign has multiple resources specific to engaging union members in the campaign for healthcare justice. If you're a union member, reach out to us and encourage your union to become an affiliate of the Labor Campaign for Single Payer. On the healthcare front, our job as activists and advocates is to come together to make healthcare for all politically possible by moving from resolutionary politics to revolutionary politics, from transactional representation to transformational change. And we do that by building a powerful worker, patient, provider, people-centered campaign, because as the grasshopper in the movie A Bug's Life said, you let one ant stand up to us and they all might stand up to us. Those puny little ants outnumber us 100 to 1, and if they ever figure that out, there goes our way of life. No one has figured that out better than trade unionists and veterans, so it's time to amplify it to better our way of life. A wise Aboriginal woman once said, if you come only to help me, you can go back home, but if you consider my struggle as part of your struggle for survival, then maybe we can work together. Let's work together. Our democracy and mutual survival depends on it. See safe.
All right, thanks. It's very inspiring, Rose. Thank you very much. And so our next speaker.
No, ignore that. Wait. Sean, are you reading?